Welcome to Module 5D. This content has a copyright by Teaching Adults, Inc. and may not be copied or reproduced. All rights reserved. CNA Lesson: Proper Use of Body Mechanics and Positioning Techniques. As a certified nursing assistant, CNA, you'll spend a lot of time helping residents with movement, transfers, and repositioning. Doing this correctly is vital to prevent injuries to yourself and to the people you care for. Part 1. Proper Body Mechanics. Body mechanics refers to the way we use our bodies to move. When you use proper body mechanics, you're reducing strain on your muscles and joints, and increasing your efficiency. Key principles of proper body mechanics. Assess the situation. Before you do anything, take a moment to assess the resident's ability, the environment, and if you need help. Resident's ability. Can they help at all? Do they have any weak sides or pain? Environment. Is there enough space? Are there any obstacles? Is the bed at the right height? Assistance. Do you need another CNA or a lift device? Wide base of support. Stand with your feet shoulder width apart. This gives you a stable foundation. One foot can be slightly in front of the other for even more stability. Bend your knees, not your back. This is perhaps the most important rule. When lifting or lowering, squat down by bending your knees and hips. Keep your back straight. This allows your strong leg muscles to do the work, instead of straining your back. Keep the object close to your body. The closer a resident or object is to your center of gravity, the less strain it puts on your body. Avoid reaching or twisting. Use your core muscles. Tighten your abdominal muscles, your core, before you lift or move. This helps stabilize your spine. Lift with your legs. Push up with your leg muscles, keeping your back straight. Avoid twisting. If you need to turn, pivot your whole body by moving your feet. Do not twist at your waist. Get help when needed. If a resident is too heavy or you feel unsure, always ask for help. It's better to be safe than sorry. Many facilities have policies on when to use a two-person assist or a mechanical lift. Elevate the bed. When working with a resident in bed, raise the bed to a comfortable working height for you. This prevents you from bending over unnecessarily. Think about it. Imagine trying to lift a heavy box from the floor. If you bend straight over at your waist, your back takes all the strain. If you squat down, keeping your back straight, your powerful leg muscles do the heavy lifting. The same principle applies when caring for residents. Part 2. Positioning Techniques. Proper positioning is essential for resident comfort, circulation, skin integrity, preventing pressure injuries, bed sores, and lung expansion. Residents who are immobile or have limited mobility need frequent repositioning. General principles of positioning. Check the care plan. Always follow the resident's care plan for specific positioning instructions and frequency. Communicate. Explain what you are doing to the resident. Privacy. Provide privacy before repositioning, e.g., close curtains. Good body mechanics. Use the principles discussed above when repositioning. Support and alignment. Use pillows, rolled blankets, or other positioning devices to maintain proper body alignment and support. Protect skin. Pay close attention to bony prominences, heels, elbows, hips, tailbone, shoulders, back of head, to prevent pressure. Use padding as needed. Frequent repositioning. Immobile residents should be repositioned at least every 2 hours, unless otherwise specified by the care plan. Ensure comfort. Once positioned, ask the resident if they are comfortable. Lateral, side lying. How? Resident lies on their side. Technique. Lower the head of the bed. Move the resident to the side of the bed opposite to the side they will be turned. Bend the resident's knee farthest from you. Place their arm closest to you across their chest. Gently roll the resident onto their side towards you, using proper body mechanics. Support. Place a pillow under the head and neck. The top arm should be supported by a pillow in front of the chest. The top leg should be flexed forward, supported by a pillow between the knees and ankles. A pillow can also be placed behind the back for added stability. Purpose. Relieves pressure on the back, good for breathing, common for repositioning. Fowler's position, semi-sitting. How? Head of the bed is elevated. Semi-Fowlers. Head of bed elevated 30 to 45 degrees. High Fowlers. Head of bed elevated 60 to 90 degrees. Technique. Use the bed controls to raise the head of the bed. Support. Pillow under the head. Ensure the resident isn't sliding down the bed. You might need a footboard or padded bolster to prevent foot drop. Purpose. Promotes breathing, eating, reading, reduces strain on the heart, good for residents with respiratory issues. Sims position, semi-prone side lying. How? Resident is on their left side, with the upper leg sharply flexed and the lower arm behind the back. Support. Pillow under the head, upper arm supported by a pillow, pillow under the flexed upper leg. Purpose. Often used for enemas or rectal examinations. Relieves pressure on the coccyx and hip. Prone. Lying on abdomen, stomach. How? Resident lies on their stomach. Support. Small pillow under the head, turned to one side, small pillow under the abdomen, pillows under the shins to keep toes off the bed. Purpose. Used for specific medical conditions, promotes drainage from the mouth, can relieve pressure on the back. Less common for general positioning due to potential breathing difficulties. Safety considerations for positioning. Lock the bed wheels. Always. Raise side rails on the side opposite to where you are working to prevent falls. Lower the side rail on the side you are working on. Explain everything you are doing. Be gentle and observe for any signs of pain or discomfort. Monitor skin for redness, blanching, skin turning white when pressed, then not returning to red, or open areas. These are signs of pressure injury. Keep call light within reach. Leave the bed in the lowest position with side rails up, as appropriate, when finished. Remember, your body is your most important tool as a CNA. Learning and consistently applying proper body mechanics and positioning techniques will protect you and ensure the best possible care for your residents.